Hello, today we're going to talk about chapters 24 and 25 from the Coding Handbook 2016, and this corresponds to chapter 15 in our ICD-10-CM codebook. You've heard me talk about chapter 15, the OB codes, throughout the semester. I find them more challenging because I've not worked in a hospital where I coded OB. So I think until you have actually worked in the field and done something, you don't feel really comfortable with it. So what I have learned about OB, I've learned from textbooks and attending lectures and that type of thing, but until I really am able to do it myself, I don't think I'll have as much confidence as I would have otherwise. And for that reason, this is one of those chapters where I read the guidelines over and over to be sure that I understand them before I even start coding an OB patient. I recommend you always read over your guidelines before you start assignments, but especially with OB. Always go to the index to find those final character codes so that you can be sure you're getting enough characters in the code, not just what's given to you in the index. If you have trouble remembering the trimesters, they are located at the very beginning of the chapter in the code book, and often the codes requiring a seventh character indicate the trimester. They can mean other things as well, but it's very often that you will have to assign a seventh character to indicate the trimester. So let's look at what I'm telling you in the beginning of the chapter. You see here, it reminds us that we only use these codes on the mother's chart, never on the baby's. And here are our definitions of trimester. If you can remember 14 and 28, you're going to be pretty safe. Less than 14, first trimester. 14 to 28, second trimester, and 28 forward till delivery, third trimester. Also, an instructional note to use an additional code from category Z3A, weeks of gestation, to identify the specific week of the pregnancy. So anytime you're using a code from chapter 15, you're going to be using a weeks of gestation code. And also when you have a delivery, you're going to always code the outcome of that delivery. That is a coding guideline. And here is the number of the coding guideline for outcome of delivery. Weeks of gestation must have been an afterthought or something, I don't know. But when you look for it in the code book, it's following Z36 for whatever reason. So that's why it's sometimes a little bit difficult to find. But it does tell you in the index that it follows Z36 to help you find your place in the code book. Seventh character can also be related to the fetus, to identify the fetus. The seventh character 0 is used whenever you have a single gestation, the documentation is insufficient, you can't clinically determine which one is affected. It's multiple, but you don't know, you can't identify which fetus. This is another one of those things, you don't have to remember that necessarily because it is in those little pink boxes near many of the category codes. Let's take a look at that. And here's an example of one of the pink boxes I'm telling you about, where it defines what 0 might mean. And even though this one is following the 036 category code, you'll see the same choices for that seventh character associated with many codes, not just this one. We'll talk more about that through this podcast. The selection of first listed and principal diagnoses, you can look at these in your guidelines. A routine outpatient prenatal visit is assigned to the Z34 category. That is not used with Chapter 15 codes. It's just a routine prenatal encounter, not used with any complications or delivery codes. Very simple. If you get into a prenatal outpatient visit for a high-risk patient, now you're moving into the O09 category, and you can use Chapter 15 codes with this category. There are also episodes when no delivery occurs, and when that happens, your principal diagnosis is going to correspond to whatever complication necessitated the patient being in the hospital or being seen as an outpatient in an ER or whatever. Reminder again, Chapter 15 codes take precedence. What that means is, what a veteran coder told me once, unless the physician has documented otherwise, you assume that a condition a woman comes into the hospital with is affecting her pregnancy. I mentioned earlier the O80 code. There are certain criteria that have to be met before this code can be used. This is taken directly out of your coding handbook, and I've seen it on many tests, not only in my course, but courses that I've taken, because I think sometimes we think completely normal delivery means no episiotomy. No, that's not what it means. We are told that with or without an episiotomy, you can use that normal delivery code. But if you have a forceps or any fetal manipulation, you can no longer use that O80 code. Any presentation other than cephalic or occipital cannot use O80, and it has to be a single infant. Twins or multiples, you cannot use that code. No complications, either during delivery or postpartum, for that episode of care. And this is an interesting fact. I was reading through some things and saw that category O60 and O77 contains some of the most important codes for situations when you cannot use the O80 code. Let's look now at some conditions that complicate pregnancy, childbirth, or the puerperium, and one of them is hypertension. You notice that depending on how the maternal hypertension is described, there's a different category code. Pre-existing O10, gestational without proteinuria, O13, gestational with proteinuria or preeclampsia, O14, eclampsia, O15, and maternal hypertension complicating pregnancy but unspecified, O16. Preeclampsia and eclampsia are very serious. I've seen both working in the hospital. I was not a coder at that time. I was a case manager. But I can recall the scariness of it. A woman goes in, especially if she goes into eclampsia and starts having seizures, it's very serious. And I have seen fathers quickly shuttled out of the delivery room so that someone can attend to a mother she's in a life-threatening situation. Okay, let's do a few exercises. This is taken from the coding handbook, exercise 24.4, number 2. Intrauterine pregnancy, 12-week gestation, undelivered with mild hyperemesis gravidarum. I encourage you, for any of these terms that you don't know, that you use our Google search engine or whatever search engine you want to use and look them up. Hyperemesis gravidarum is not uncommon in pregnancy. It's a pretty serious thing. I believe it's caused by rapidly rising HCG hormones in a woman's body, and it can make her have severe nausea, vomiting, really get her electrolytes off, and lose a significant amount of weight. In this case, I have the rationale and the pathway there, and the weeks of gestation captured, so you can see that's pretty straightforward as an example. Get a little bit harder. This is a cesarean delivery of a stillborn at 38 weeks owing to placental infarction. Placental infarction is not found in the index. So when you start looking for this code, you are taken to placental disorder, and you do know what it is, so I would use specified. But a couple of times in this course, I've told you about those times when the index gets you in the neighborhood, but not to the specific house where you want to be. So you have to go to the tabular, and when you find this 043.89, if you look above that, you find 043.81 with the infarction. So let's take a look at that. So anytime you are given a 0.9 or a 0.89 code, always look around just to see if there's something, and it just so happens in this particular case it's right above it. It's not always that easy. But as I've told you before, you can never rely on the index to give you your final code. You've got to go to the tabular and look up what code the index has given you to be sure you're selecting the right code. In this case, there you go. And that sixth character, it tells us we need 6 characters. The 6th character is the trimester. Okay, let's continue. We know from our earlier slide we have to always code outcome of delivery. In this case, it's a single stillborn. So you're going to be selecting the Z37.1 code. Let's look at that. Okay, here's the Z37 code, and you see how we're given so many choices. Single live birth, single stillbirth, twins, both live-born, one live-born, one stillborn, both stillborn, and then your multiples. And I have a note here that says exempt from POA reporting. POA is present on admission. We'll talk about that more a little later on in the semester. But this is just my note to myself to remind myself that we're not going to be reporting a POA indicator for outcome of delivery. Whenever there is a fetal death, you will code this pregnancy complicated by fetal death O36.4. And you see here where we've had to use the 5th and 6th character placeholders in order to assign the 7th character for the fetus. So there you go. And here's the weeks of gestation. Okay, let's look at one that's a little bit more difficult. An intrauterine pregnancy, twins, 33 weeks, premature rupture of the membranes with onset of labor 3 hours later, spontaneous delivery of premature twins, vertex presentation both live-born, postpartum pulmonary embolism. A couple of things come to my mind. One is that I know that preterm labor is defined as an onset of labor before 37 weeks. And in this case, it's a 33-week pregnancy. So we're going to be coding preterm labor at some point. So I went through and I looked at what was given to us and what we're going to need to code, and I see the preterm rupture of membranes with preterm delivery. You can have preterm rupture of membranes without delivery, so that's why you're going to say with preterm delivery. A premature rupture of membranes with onset of labor within 24 hours, because there's choices to have codes that are more than 24 hours. Twin pregnancy, postpartum, outcome of delivery were twins, and the weeks of gestation. Okay, what I am showing you here, your textbook gave O60.14x0 as the answer. That is incorrect. The publisher sent out what's called an errata, E-R-R-A-T-A, which is something publishers send after they have published a book and it's been printed and they find an error. And the error that was reported was that because these are twins and each one had a premature labor, was affected by the premature labor, each one gets a code. So 7th character 1 is fetus 1 and 7th character 2 is fetus 2. So that's how you get these two codes. And then here I added preterm delivery of each to remind me that each one gets the code. So now let's look at the next is the complication of the premature rupture with the onset of labor within 24 hours preterm, because we were before 37 weeks. That gives us this O42 code, and the final 6th character in this case is the trimester. And here is the last few codes where you have a twin pregnancy. Anytime you have multiples, you're going to be assigning a code specific to that. In this case, it was twin. It could be multiples. And we were not told in the documentation how many placenta or amniotic sacs there were, so you're going to choose the less specific O30.00 with the 6th character indicating it was the 3rd trimester. O18 is the embolism that was mentioned here, the postpartum embolism. It's P-U-E-R-P-E-R-A-L, puerperal, and that is postpartum. So that's going to determine your final characters. Outcome of delivery, twins, both live born, and your weeks of gestation. Here's another one. Premature delivery, third trimester with a frank breech presentation, single female live born, first degree tear of vaginal wall. We know it's premature, so you've got preterm delivery, third trimester. Because it was a breech presentation, you have maternal care. You have a tear of the perineum. Outcome of delivery, single, live born, and the weeks of gestation. In this case, we're not given. The third trimester only was given, but that does allow us to assign a specific code. Look at it on the next page. Here is your pregnancy complicated by preterm labor, third semester, with third semester preterm delivery. The pink box we've mentioned earlier with the seventh character. The seventh character, 0, is fine because we've got one baby, so that's correct. Now we're going to look at the breech presentation. It also allows us to assign a seventh character. Here is the explanation. And here we go with the perineal laceration here, the outcome of delivery, and the pregnancy. Okay, I'm going to stop there, and we will do part 2 to finish our